Welcome to the Fabulous 50s and Beyond. I'm Jim Pollard, your co-host, with my wife, Janetta. This session today is going to be quite interesting. It's one that is a topic that we need to cover. It's been covered on national television a lot, and our guest today is Dr. Cuadrado, and he's going to be talking about our colon, and since March is the month for colon screening.
Colon Cancer
Awareness Month.
Yes.
And we want to be talking about this. I look around the studio, there's 5 of us in here, and the statistics tell us that 1 out of 5 is a prime candidate for colon cancer.
Yes.
And that's pretty heavy when you think about it. I think that 1 out of 5 here could have colon cancer. So you stay tuned and we'll be right back.
And he'd say, go with what you got. Start from where you are. Give it your best shot. Keep reaching for that star. Get in the race, keep your own pace, keep moving and never stop. Just go, go with what you got.
Welcome back. Doctor, this is going to be a pretty good discussion today, I think, because is the reason that most people don't have their colonoscopy fear?
Fear is one of the reasons that they don't, and of course there's also the issue of personal embarrassment, because we are going to invade your body at that time. But most of the people that do have their colonoscopies are rather, they tell us afterwards that, gee, I was more scared than I needed to be. It's not a very uncomfortable exam. And it's so helpful for finding and treating a condition that's the 3rd leading cause of cancer deaths in this country, and it's at least 90% avoidable or curable.
That's interesting. That here's the 3rd leading cause of cancer.
Yes, cancer deaths.
Cancer deaths, and that is treatable.
Yes,
and preventable almost.
Over 90% of it is preventable or treatable.
And that's so interesting that, and yet people still don't have it done.
Well, they don't have it done again because of most of a fear or just lack of knowledge, or I don't want to say ignorance, but ignorance is really the reason, which is why this discussion here, as well as the seminars that we put on, particularly this month, are very helpful. It's a way that we healthcare professionals can allay the fears that they have, answer personal questions that people come to our seminars for, and try to encourage them, and then have them encourage their family members to also be studied.
Well, I was going to ask you, are women more
susceptible?
No, to have it done?
Women are much more smarter than men.
Well, I knew that.
So the answer to your question is yes, and women are also the health drivers of the family. So are more likely to go, but also they're more likely to drag their husband to go. And they have saved many lives that way.
Well, see, that's what happened with us. I went, and then a little bit later he went. I had no polyps, but he had about 6.
Well, then you did him a great favor.
Interesting thing is I had 6, and then when I went back the next year, 18 months later, I had none. So I feel like that was a big lifesaver for me.
And it's important because colon cancer is a condition that extends for a long time. And the polyp is the key. The polyp is the precancerous abnormality. And we can say that any and every polyp that we've ever taken out of an individual has never become a cancer. And more so, we have seen the death rates of colon cancer decrease, as well as the incidence, predominantly because of colonoscopy, screening people who are at low risk and studying people who are higher risk.
Does most insurance policies cover a colonoscopy?
Most insurance policies in our state, Kentucky, do cover screening colonoscopies. Now, the language of the policies are all different. Some may require a copay if we find a polyp, which doesn't. The logic of that has never really sunk into me. But I think it's required by the Kentucky state law to cover screening colonoscopies.
And of course we're on Medicare, so we know
yes.
we know we're covered there for the time being, anyway.
For the time, yes, sir.
And one of the things that we want to talk about today is two happenings or events that you've got going on.
Mm-hmm.
One is, they call it the Incredible Colon, and it's a traveling display is actually what you told me.
Yes.
And it's going to be March 19th at Graves County High School Fieldhouse, and it's actually I guess an inflatable synthetic type colon that you can actually walk.
You can actually walk in through it and see different things that occur in the colon, and we'll have people that will explain what these things are, and what, if anything, you need to do for them.
So it'll actually, does it actually have like a polyp in there?
You'll see polyps. You'll see diverticulosis.
Really?
You'll see some colitis, and of course there'll be cancer there also. Just to give you a bigger than life feel for what can happen.
Well, I would think that does a lot to help people.
Yes.
Maybe not be afraid, or to go ahead and do it, you know, in case they might have one of these things.
Any and everything we can do to encourage them, because what we have seen certainly in the last decade is a decrease in the incidence and the deaths of colon cancer. Those of us that have been doing colonoscopy for years knew that we would see this happening, but it took some time. Had we had this discussion 2 years ago, I would have said that colon cancer is the second leading cause of death of colon for both men and women. It's come down to the third. And the goal that we have is really to try to get everyone screened. We think that we can make colon cancer a very rare cancer.
Well, that's another thing. Is there an age
Yes.
where they should start?
Well, the recommendation is that at age 50, this is when we should start doing screens for people that are at low risk. There's a reason for that, because if we see the distribution of colon cancer at age 50, the incidence begins to rise, and about 70%, 80% of people with colon cancer are beyond the age of 50. But there's a really concerning happening that we're seeing. We're actually now picking up a lot of cancers younger than 50, and that's bothersome. And that's probably a function of our lifestyle. We do things that are not colon cancer safe.
Mm-hmm.
Well, a lot of it would be the way that we eat, wouldn't it?
It's mostly the way that we eat. Our Western Kentucky diet is so high in fat and so low in fiber, low in calcium, and those are the protective things that help us prevent colon cancer. Also, we as a group do not exercise. Actually, exercising can probably lower the risk of cancer for any given individual by 15 to 20%.
That much?
Yes, sir. And there are other things that we unfortunately in Kentucky smoke far too much, which is another risk factor for cancer.
Well, we were talking earlier, and that in all the diseases and sicknesses that we've talked about, it seems that two factors are diet and exercise.
Exactly.
And everything.
In everything. Well, there are things that we can control and things that we cannot control. Now, obviously, we can't control our genetic susceptibility.
Right.
Because we can't pick our parents. They're given to us. But lifestyle we can change, and the way we eat, the lack of exercise, smoking, all of these things are responsible for many of our health problems. Not only colon cancer, but other cancers, heart disease, stroke, diabetes. So again, if we can alter these, we can make an impact as much as 25% of all the colon cancer that we see.
Mm. Well, again, this first event we're talking about is Incredible Colon. It's at Graves County High School Fieldhouse, March the 19th from 9 a.m. to 3 p.m. and it is free. Yes. And open to anyone, and you'll be actually passing out. It says here, educational material for the people.
Yes, and we'll have people there also to ask questions. Yes.
And everything. Well, I think that's fantastic, and that's going to be on. Later on, we want to talk about that seminar, but I'm interested in how we can get more people involved in screening. And are there other screens other than colonoscopy?
Well, screening is the key to preventing many other conditions. Certainly, though it's controversial, and you'll hear a news story argued back and forth, the other significant cancers are breast cancer, of course, in women, prostate cancer in males. These should also be screened very carefully. And I guess if if cigarettes disappeared from the face of the earth, lung cancer may also follow shortly thereafter.
Really, that much?
Yes, sir.
That's so much more of a factor than just smog or
Well,
anything.
I mean that there is cancer not related to lung cancer, not related to smoking, but it's such a small number. We would be talking about a rare disease, literally a rare disease, and it's the largest cancer killer in the country.
Well, now your practice is out of Mayfield, right?
Our Purchase Gastro Associate is out of Mayfield, but we have offices in Murray and in Benton. We're a collection of doctors that actually formed this practice because we had an ability as a group to offer not only standard diagnostic testing, but also some specialized testings that such as endoscopic ultrasound, ERCPs, that our patients would have to go to one of the Louisville, Nashville, St. Louis. So we save them 4.5 hours driving to these places, and they can stay and get their care at home.
Okay, another question for information for me is the gastronomical. Does that cover the stomach and all of the intestines?
A gastroenterologist covers all the intestines from mouth to the other end.
Okay.
But it also involves diseases of the pancreas, diseases of the liver. Basically, everything that's connected to the gastrointestinal tract.
Okay, okay, because that's good to know. That you're actually a practice that covers all of them.
Yes.
Okay, well that's good to know. Go ahead.
So you have several doctors in your group?
We have 4 doctors in our group. Dr. Tarak is and Dr. Hender have joined Dr. Finch and myself. It allows us to do some very specialized testing because now we have the personnel and the staff with these selective expertise. And actually we've become we've evolved into a regional referral group for these specialized procedures that I mentioned a short while ago.
And you have the equipment and all.
And we're equipped, and we have specially well-trained staff to support us.
Yes, well, Dr. Finch is the one who did both of ours.
Yes, Dr. Finch is a good man.
All right, well, first half's over, believe it or not.
Yeah, really.
It goes fast. I mean, you're giving us a wealth of information here, and great information. So you stay tuned, and we'll be right back.
Travel advisories to small business loans, retirement savings to Medicare coverage, ID theft protection to contacting elected officials, student loans to taxes online. Whether you have information to get or ideas to give, USA.gov is the official place to connect with your government. From surplus car auctions to finding a new job, our new mobile apps will keep you updated on the go. So, from marriage records to passport applications, veterans benefits to birth certificates, patent applications to energy-saving ideas, product recalls to home buying tips. Check out USA.gov because the country runs better when we stay connected.
Welcome back. We're talking about the number 3 cancer killer
That's correct.
today. And so that's the reason we hope that you pay particular attention, especially since a lot of our audience is really aimed at people over 50, and this is the crowd that it hits the hardest.
That is correct.
And so we want you to pay attention as we talk about colon cancer and some of the other diseases. And one of the things we want to talk about first is this informational seminar that's going to be conducted on March the 28th at 11:30 to 12:30. It's a luncheon and it's free, and it's at the Jackson Purchase Medical Center in Mayfield in the community room there. You do need to pre-register if you can, and they'll be putting the numbers up. Also, you can go to our website, which is thefabulous50s.net, and we'll have this information up there on how to register and the phone numbers and everything. So that's very important. So tell us a little bit about what will be covered in this seminar?
Well, at the seminar, we'll discuss the risk factors for colon cancer, who should be screened at what age, and more importantly, why. We'll talk about the options of screening, because there are many, and which suits the given individual better than the other. And we hopefully will open the discussion to questions that relate to that particular individual, and we have it's informative, and the lunch is usually quite good, by the way.
Okay. Yeah, their food, the hospital is good. We've eaten there several times. I've taken 3 rounds of physical therapy over there. So,
Sure.
so I know, and but yeah. So it'd be, I guess it'd be about an hour, is what it says.
It'd be about 45 minutes or so, and then we'll open the discussion to questions and comments, and we'll go as long as there's a question to be answered.
Okay.
So what are some of the ways that we can prevent colon cancer other than our diet and exercise?
Well, the most important way to prevent colon cancer is to get a screen. Okay, it's the screening that will detect the problem very early. And at the time of the screen, if we're using colonoscopy, you can actually remove the polyp and resolve. I meant it almost as a joke, but it's true. If you remove the polyp, it never becomes a cancer. And it also then identifies those individuals that are at higher risk for screening, for closer screening. But I wouldn't minimize that just diet and exercise. I mean, that's critical. Which we estimate that can reduce the incidence by about 25%. Other things we can do is exactly what your doctor will tell you. Try to keep your weight as close to your ideal as you can. Exercise regularly. Cut down on the amount of alcohol that you consume, and please stop smoking. That we know is a major risk factor.
Go ahead.
And some people just, they're not going to give up their smoking. It just,
We'll keep
trying. We'll keep trying.
We'll keep trying.
And of course, there's a lot of things. And what is there any signs that I might think that I have cancer? I mean, cancer colon of the cancer.
Well, the symptoms of colon cancer usually occur late in the process. Remember, the moment you form a polyp that may have potentially become a cancer, it may take anywhere between 10 to 15 years before it's a cancer. So for that long period of time, there may be no symptoms at all. One of the symptoms that you may find is that you may have there may be rectal bleeding. Either blood passes bright red blood, or dark stools, which may also be blood. It's sad to say how many people we see with that complaint for a lot of years that they think it's their hemorrhoids. Now some people are right, but I've stopped counting the number of colon cancers that I've seen that people that came to see me because of hemorrhoids. Other concerns or symptoms that you can have for colon cancer could be a change in your bowel pattern. Is the stool, has a change in size? Is it getting thinner? Is it painful to pass? Are you getting the urge to go to the bathroom and nothing is happening? Are you having pain, abdominal pain, particularly lower down pain? Do you feel fatigue out of proportion to the amount of activity that you've done? And we all do feel that way. I have to admit. And also unintentional weight loss. That may be a sign that there may be something serious. And the older you are, the more these signs and symptoms become important to be screened.
One thing that I would like for us to talk about a little bit more is this ERCP and endoscopic ultrasound.
Yes.
And it says here that you're the only ones that offer that service.
Yes, well, our group is the only one that offers it in the area. As I said, we've evolved into a regional referral center. Endoscopic ultrasound is endoscopy with a scope, either going through the mouth or colonoscopy, that is used either to diagnose a cancer or stage a cancer to tell us what would be the appropriate treatment. Endoscopic ultrasound is the most sensitive test for pancreatic cancer. It's better than CT scan or any other scanning that one can do. And not only can the reason is the pancreas lies right behind the stomach. The endoscopic ultrasound is put right against the stomach, so you're right against the pancreas. And we actually do biopsies in that fashion, and it helps us stage those people whom we can send to an operation and those that are not operable. ERCP is another advanced technique that we use that either for obtaining tissue from the pancreas, or often just to remove gallstones from the bile duct that have remained after gallbladder surgery. And again, we have an extremely good trained staff that assists us with those procedures, and we basically have become a regional referral group.
So the gallbladder is part of your practice also?
Remember, the gallbladder is attached to the bile duct, which is attached to the intestine. So if it's connected, we do it.
Okay, okay. I mean, I've had gallbladder problems before. Eventually I had it taken out, you know. But it's pretty interesting. And all of this is real interesting to me because over the years I've had different sorts of problems, not necessarily with my colon, but with my gallbladder or with my stomach and different things. Interestingly enough, one year I went to the doctor and they did all the upper GI series, and he said, "When did you have an ulcer?" I said, "I didn't know I ever had one." He said, "Oh, you had one because the scar tissue is there, but it's gone."
That's not unusual. That's not unusual at all. Ulcers do come and go. They're very commonly due to bacteria that occurs in the stomach. So even if we treat the ulcer, or the ulcer is treated by however it's treated, if the bacteria is still there, you're at high risk of having it come back again.
Is it true now that the assumption is, or that ulcers are caused by bacteria?
We think that about 65% of all ulcers, both in the stomach and the small intestine, the duodenum, are caused by this bacteria, H. pylori. And which is why when we do find it, we not only treat the ulcer, but we also treat the bacteria to eradicate it so the ulcer doesn't come back. The vast majority of other ulcers are caused by what we call NSAIDs, aspirin, Aleve, ibuprofen, non-steroidal anti-inflammatory medications that we use for arthritis. They're the most common cause of the remaining ulcers. And then there's a 5% of people who we never figure out why they have it, so we just treated them and they get better.
Well, I guess that was an interesting evolvement in the treatment of cancer, because in my lifetime I think I can remember when they began to say that it was caused by bacteria.
Yes,
a lot of them.
Dr. Marshall is an Australian gastroenterologist. When he first presented this data on bacteria and ulcers, he was at a conference in Europe, and they almost laughed him off the stage. He went back there about 30 years later to get the Nobel Prize for his discovery.
That's interesting.
Well, didn't we used to think it was because you were...
Stress?
Stress.
No, that's what we used to say, but stress makes everything and anything worse. And stress does not cause ulcers. Bacteria or medications do. Now, stress makes an ulcer worse because you do make a little extra acid with it.
But
okay.
It's interesting that what you said about the aspirins and the leaves and things like that cause it. I've heard of them. People say they kind of eat a hole in your stomach.
Well, yeah, they destroy the lining, and that's what an ulcer is. If you want to think what an ulcer is, if you ever fell down and took the skin off your knee or something, you would look down. That would be what an ulcer looks like inside the stomach or the small intestine. And what these medications do, they sit there, and because of some chemical reaction with the addition of acid and sometimes the bacteria, they create a hole in the stomach, which can either be painful or non-painful, but it can also bleed, and some of the bleedings that occur can be also life-threatening.
Can that be temporary?
Yes, yeah. There are many people who've had ulcers and have never had a single symptom from it. We find it when we scope them, but the majority of people have episodic events with ulcers. That is, they have a problem for a couple of months. They may or may not take something for it, and they get better, but it comes back again. Do
you do the procedure where you actually swallow the camera?
Yes, that's the endoscopic enteroscopy is what we call it. It's really what it is a camera. It's designed to look at the small intestine mostly. Of course, we look at the esophagus and the stomach, but it's really to give us a view of the small intestine. The small intestine is really the longest part of our intestinal tract. It's about 22 feet long. And we do have scopes now to look at these areas, but before we do, we get the capsule study to see whether the problem is high up, in which case we can do the scope from above, or whether the problem is at the lower end of the small bowel, in which case we go from the bottom and go into the small intestine that way. And we're capable of seeing the full small intestine now.
That was quite a revolution too, when you could swallow a camera.
It was great. It was great. It was great.
I was thinking about that the other day. And I guess you actually start the recording the minute it goes down, and you record.
Well, actually,
everything.
we started before they swallow it, so the first few pictures are interesting to look at, and it takes about from the moment that it starts firing pictures to the moment the battery dies. It takes about 58,000 pictures. So you actually almost get when you put it together, you almost get a film of the intestinal tract. And obviously, when we find something abnormal, we freeze those pictures and try to figure out what it is.
Very interesting.
It's amazing technology.
Well, we don't quite have Dr. McCoy's tricorder yet, but we're getting close.
Well, you know, we're about out of time. And I just want to cover the things that are going on. One is the Incredible Colon. Now, if you're looking at this after March 19th, that's done.
Mm-hmm.
But it is a traveling display,
Yes.
so you might could find it in your area if somebody's looking at
Mm-hmm.
it. And the other thing is the informational seminar, which is March the 28th, 11:30 to 12:30, in Jackson Purchase Medical Center Community Conference Room. You need to call and to get a reservation or to make sure that you have a place there. The number is 270-251-4580, and again, that will be up on our website. All this information will be up on our website at thefabulous50s.net. Doctor, and you will be conducting the seminar.
Yes, I will.
It's been very informative, and we really appreciate you being with us today, because a wealth of information, and that's what we try to give out to our audience out there, because they need to know about this. And as I said, those of you who are watching, most of you are probably over 50, and you need to go have colon screening.
Yes, sir.
And so we want to invite you to be back next week. We'll be here with a new show. Be sure to watch every week. We're here, and you remember that this is streamed online. If you have someone in any part of the world that you would like to see this show, just send them the numbers there, and they can get it. Now remember, use it or lose it.
Can't see as well as I used to. Can't run as far or as fast. Sometimes I think that the old me is becoming exactly that. But when I start thinking of all I don't have, that's when I tell poor me Beethoven was 50 and deaf as a post when he wrote his Ninth Symphony. And he'd say, go with what you got, start from where you are.